Hi, I'm Chloe Lance, and I was a student that was interviewed last week for my first week of field work in the hand therapy setting. And I'm back this week with a little bit about what happened during week two. So week two was good. It was a lot of fun. I got to start helping treat people based off of their treatment plans that Steph had already available. So that was interesting. It definitely takes time and understanding to figure out what each thing means, what the best way to manage the time of the treatment session. I feel like that was something that I struggle with the most right now, knowing, how long to passively stretch someone, how long to actively stretch someone, and going through that process and making sure that you're spending enough time on the certain things and watching the clock because I feel like I'll be like, oh, I feel like that's 10 minutes and then it's, 15 minutes and then I'm like, oh crap, now I gotta try to make sure everything else fits in. So just making sure that I'm watching the clock and following through for the whole care plan. And I also got to help with my first eval this week. So that was both very nerve-wracking and exciting at the same time. I was extremely nervous. I mean, I'm sure as anyone who's also gone through the fieldwork process, it is nerve-wracking to feel like you're, finally a practitioner in some regards. And I honestly feel like it went well. Steph had me ask a lot of the background questions, getting the history of present illness, pain rating, all of that stuff. And I feel like I took my time because I wanted to answer all the questions to the best of my ability, to get that from the client. But I feel like in that regard, I took too much time. We discussed kind of afterwards that, that background information should only take, 10 to 15 minutes. And here I am taking, 20, 25 plus minutes because it is difficult to be able to kind of reroute the client and the conversation. Sometimes when someone has a super involved diagnosis, injury, etc., it can, quickly become a conversation that, could last an hour plus because it wouldn't, they have so much that went on. But you have to remember to be able to kind of reel it in and figure out, what do I really need to know to treat this person appropriately in the best regard. So I feel like that is something that I'm definitely going to work on and hopefully take into week three to start to continue the eval process. But remember that, I like Steph told me, you're trying to tell a story. So, you got to figure out what happened, but then also you need to know enough to treat them. But it doesn't always mean that you need to know every single little detail that might not be relevant to, in this case, the hand injury or the upper arm injury. So this is kind of where we're looking and how the week went. It went well, and I honestly am really enjoying my time here. And we're just working on getting me able to document currently. There's some issues with the documentation system here, so I'm just struggling to be able to get into the system to document myself. But I've been helping Steph in that regard, and it's been going well. And I know that she's going to help me each step of the way. And, there's times where if I'm treating someone, I'll ask, like, hey, am I doing this right? Or can you show me how to, uh, stretch this person? I know a lot of times for me, it's difficult knowing the hand placement, like knowing where to put my hand to get the best stretch for that individual. So I feel like even though I've watched her do it, it's a lot different when you're doing it yourself. It doesn't look as hard when you're watching. And then when you go to try to get your own hands to work like that, you're like, oh, that it's a lot more difficult. And I feel like I get really nervous. So I kind of know what I need to do, but I also forget at the same time in that moment. So it's just taking things one step at a time and remembering, like like Steph likes to tell me, it's a learning process, Chloe. You'll be fine. You just got to take it one step at a time, and everything will work out in the end. And when you get to week 12, you're gonna be like, oh my gosh, I can't even believe I was doing things like that. So I'm just gonna keep working on that, and we'll go from there.